Morning, everyone, or afternoon if you are in the Central or East time zone. This is Janet Walker with the National Wraparound Initiative, and I'd like to welcome you to today's webinar entitled Wraparound Team Monitoring System. And we are going to be hearing briefly from Eric Bruns, also of the NWI and the University of Washington, and then from Kelly Hyde of Social Technology. I'd just like to let you know a little bit about how we're going to be handling the questions today. All the participants are muted, and if you have questions, we invite you to chat those questions to us using the chat function that is part of the webinar functionality. And we will take a look at those questions. We'll answer some of them that seem particularly relevant to the sections as we go along, and we'll have time to answer some more at the end. So with that in mind, I'm going to turn the webinar over to Eric Bruns, and once again, welcome everyone.
Yes, good morning or afternoon. This is Eric. I'm sitting here in my office in Seattle, Washington at the University of Washington. Thanks to Janet, with whom I co-direct the National Wraparound Initiative, and thanks to Janet also for serving as moderator and host today for this NWI webinar. So this is going to be primarily myself and my very good friend and colleague Kelly Hyde. Dr. Kelly Hyde is with Social Technology. She is the CEO and lead IT guru with Social Technology, and she is in Santa Fe, New Mexico. And together we are going to be giving an initial preview of a web-based data collection, management, and feedback system for Wraparound that also provides a foundation for managing all sorts of care coordination models or team-based care models. We certainly all come at this from a wraparound orientation. In fact, this is something that we've been working on for nearly 2 years now. But you could argue that Kelly and I have been working on this for about 20 years. It was 20 years ago this month that Kelly and I first met one another when I was a first-year graduate student with John Burchard, my mentor and one of the grandfathers of Wraparound. At the time, John was very interested in the question of how technology might support implementation of better services for kids. And so it's kind of interesting to me that literally 20 years to the month later, we're doing this little preview of this system for the field. So go to the next slide there, Kelly. Kelly's got control of the system here, the webinar.
Okay. Hold on one second.
So just a little bit of background. We're hosting this webinar under the aegis of the National Wraparound Initiative. The Wraparound Team Monitoring System that we've been developing certainly aligns with the mission of the National Wraparound Initiative very closely, in that it's a system that is very explicitly designed to be a resource to facilitate high-quality, model-adherent wraparound that has the best chance of facilitating positive outcomes for youth and families. And that really is the mission of the NWI, which is to promote understanding, but also to provide the field with resources and guidance that facilitates this kind of high-quality wraparound implementation. The Wrap-TMS system is really at the beginning of its development, and this is our first real public kind of preview of the system. But we really do believe that it has the potential to also align with many of the core functions of the National Wraparound Initiative. We're thinking that it will help facilitate community and program level implementation and keeping an eye on outcomes at a community level, at a state level even. We think that it will help promote professional development of wraparound staff, because there is a very a purposeful supervisory function that's built into Wrap-TMS, as you will see. And certainly it's intended to support enhanced accountability through its many evaluation and reporting features. So we at the NWI, Janet and myself, are very pleased to be associated with this effort. Real quick, it's also worth noting this is the first webinar of the new contract year that the National Wraparound Initiative has with the TA partnership at the American Institutes for Research. And so we thank SAMHSA and the Center for Mental Health Services, Child, Adolescent, and Family Branch, and the TA partnership for their ongoing support. There's going to be several more webinars over the course of the next year, so stay tuned. But today, go ahead to the next slide there, Kelly, we're going to be talking about something that we're calling, at least for the moment, Wrap-TMS, or the Wrap Team Monitoring System. Kelly also likes to refer to it as team monitoring or team management made simple. What we're going to do today is give an overview of the purpose and the intent and basic functions of the system. And then Kelly is going to do a demonstration of just a few of the features, give you a kind of sense of the overall look and how you navigate around the system, some of the functions and features that it has. And at the end, we're going to tell you about how your initiative or community or wraparound program can inquire further about trying out Wrap-TMS. And we're going to, along the way, have time for questions, and Janet will facilitate that process. So before we even get started, why don't we launch the first poll real quick and see who's out there. We've said who we are. So Nancy, if you could quickly just launch the first poll. And if folks could choose the best answer about what kind of role they serve in your local system of care. And apologies for only being able to provide 5 options, but the fact is that GoToMeeting only lets you have 5 options. So I know there's a lot of other kinds of roles out there. If you're an other, I guess just don't, if you don't have a good answer here, don't make one. But go ahead and select your best option. And while you're doing that, just to give you a heads up that everything about this little demo and webinar will be recorded and available on the National Wraparound Initiative website in slide format or the entire webinar so that you can view it or share it with colleagues later. So I'm going to close the poll, or Nancy, you can close the poll. And we have a lot of providers, which is great. It looks like we also have about a quarter are public systems representatives, state or local partners. We have some IT specialists and some evaluators, only a couple of youth or family members or youth or family advocates, and about 9% of you are trainers or TA providers. So a good mix of folks. Thank you for letting us know who's out there. So let's go back to the PowerPoint. So real quick, I'm going to do an intro about the where we've gotten funding and the basic features, and then we're going to hand it over to Kelly. So Wrap-TMS is intended to be a comprehensive web-based data collection, management, and feedback system that will help communities and wraparound initiatives implement integrated team-based service approaches for individuals who require that kind of care coordination, such as the wraparound process. Go ahead to the next slide, Kelly. So want to acknowledge, again, this has been something that started almost 2 years ago when we first submitted a grant proposal to NIMH to simply ask a research question, which is if we had a relatively simple system to feed data back to wraparound teams and the team members and the facilitators about the progress that's being made, the kind of satisfaction and fidelity to the process that team members perceive. If you fed that data back into the team process, would you get a sense of people being more satisfied with the process, better outcomes for young people, better quality of teamwork? So we want to thank NIMH for initial funding of this project. Along the way, the Child and Family Branch as well as CMS have provided support for us to develop this because they see the potential of systems like this as really being a leader in healthcare reform and keeping integrated care models on track. So thanks to them, as well as the Institute for Implementation and Innovation at the University of Maryland School of Social Work has been a partner in this along the way, and a funder, and their Maryland Department of Health and Mental Health. Okay, want to get that out there first. So we've had substantial support from federal sponsors around this idea. Next slide. So what you're going to see is a system that is intended to provide a way to manage and access key information on the wraparound process or other kinds of integrated care processes. And the kind of information that is managed in Wrap-TMS are things like information about the individuals that are engaged in the process for an individual youth. So the youth and family members, team members, the providers who are involved or on the team, natural and community supports. These folks are all information, contact information, ways of communicating across these folks is a core feature of Wrap-TMS. TMS also is a way to manage the key documentation of the wraparound team process, including the plan of care and the different components of the plan of care, strengths, needs, the family story, family history timeline, meeting and appointment times, meeting notes, contact histories. As you'll see, all of this can be managed within the system. So it's all in one place and promotes transparency. Any members of the team who have permission can go in and pull down copies of any of these different pieces of documentation at any time. And so it's something that we hope will promote a better organized process and a more transparent process. Going beyond just some of those basic documents, the system is intended to track family satisfaction, basic assessments of fidelity to the wraparound process, and progress towards meeting the high priority needs that are in the plan of care. And finally, outcomes such as the level of youth and family support, residential placements, educational outcomes, and youth functioning. All of these are built into the system now, and communities or initiatives that use Wrap-TMS can build their own different kinds of assessments into their specific configuration. So that's a real core part of TMS, is being able to monitor those outcomes. Next slide. Okay, so what do you do with all that information? First of all, it's important to know that each individual community can configure the system to manage those pieces of information and those elements that are most important to them and the highest priority for them to manage. Doesn't have to be all of those things, could be a subset, and you can also build in your own different assessments, as Kelly will describe in a little bit. The idea here is that at a youth and family level or a team level, this is going to promote better outcomes, better organization, hopefully a better team process by aiding that communication between team members, allow transparency and information sharing as the different team members can all access the same information. It's not something that can be perceived as being only in the domain of the WRAP facilitator or the wraparound agency. And as you'll see, it also has features that help assist in documentation compliance. A facilitator will have a checklist of the requirements that they have to have completed, reminders for when updates are due, and supervisors and managers will be able to review documentation compliance for all the levels below them, the different youth, the teams, their facilitators, and so forth. So it's intended to help keep teams on track, not just in terms of organization, but also when you're collecting this kind of data at a interval that works for you and your team or you and your program, you can view progress towards the needs. Always have a reminder of what are the priority needs we're working on. Have a way of systematically asking and recording whether progress is being made, whether the families, you're getting closer to achieving the family's vision for the future, and systematically inquiring about satisfaction and fidelity. So is the process working for this family and this team? That kind of information can be brought to team meetings or be something that the facilitator can take stock of to keep themselves on track. Next slide. So in addition for individual teams, it could also be something that can help keep an initiative of hundreds or even thousands or a state-level initiative on track, because at higher levels, all those data through the permission-driven system that the system features, all those data can aggregate up to different levels. So supervisors can review the progress that's being made for youth of the facilitators that they manage. Evaluators or managers can take a look at placement cost, service mix, staff performance, outcomes that are being achieved for the entire initiative or different segments of the initiative. So the idea is that not just teams and supervisors, but at high levels, managers and administrators, even all the way up to state levels, can monitor implementation outcomes and costs in real time. This is the dream. So the next slide. Just another note, the foundational system that we're building will also provide the new platform for entering, managing, and running reports for the fidelity assessments that we disseminate here from the University of Washington Wraparound Evaluation and Research Team, including the WFI, the Wi-Fi Easy, and the Team Observation Measure. This new platform is going to replace the Wraparound Online Data Entry and Reporting System. Some of you probably are very familiar with. It's called Wonders, and it's been under some stress of much, much more use and than we expected ever to have. So this will be a huge improvement. It'll have the same features and functions, but work much more effectively. Okay. Why don't we go to the next slide, and I think it might be time for another poll here. Let's take a look real quick. Next slide. Okay, so why don't we pause here and just launch one more poll, and then I'll finish up and hand it over to Kelly. So next poll, please, Nancy. So I just did a real quick kind of overview of the data elements that are going to be included in TMS. And we're wondering, you'll have 3 or 4 more polls where we're going to get information from you all that's going to be helpful for us as we continue development. So one question is, among those who are on the webinar right now, and it's 160 it looks like, what data elements does your wraparound or system of care IT system manage? And this could be not applicable because you're actually not part of a system of care yourself, or you don't have a system that manages elements such as these. But you also have some options that you can check, and you can check all that apply. So the service elements like the plans, strategies, services, and costs, process data like fidelity, satisfaction, and progress toward needs or goals, and outcomes data like placements, community functioning, and so forth. Check all that apply, or if it is more appropriate to check not applicable or that you don't have an IT system, check those options. It'll be interesting to see what folks who are on this webinar say here. And we'll give you a few more seconds. All right, what is the result of our poll? So interestingly, 1/3 of the folks who are on are part of an initiative but don't have a system that manages elements such as these. Another 8% are not connected to a system of care. It looks like most of the other folks have a system that does all of these things, plans, costs, process data, and outcomes data. So it's an interesting kind of mix here of about 1/3 of the folks have nothing, and then those who have something, it looks like they have systems that do quite a few of these things. So that's a good segue to the last part of my little spiel here. If we can go back to the PowerPoint. So why did we develop TMS? Well, go up one more, Kelly. So at a big level, we know from research that collaborative care models and all sorts of healthcare models are more effective and outcomes are better when decisions are informed by reliable and relevant information. But we also know that states and wraparound initiatives and providers have often struggled to find ways to manage data and information. But it's really important that we
Hello, can anybody talk?
Hi, I'm back, but I got kicked off. Did others get kicked off?
Well,
Yes, I did too.
I've gotten a whole bunch of emails saying that people can't hear us. I don't know. Can anybody, if you can hear us, can you send a little email? Oh, we can hear now. Okay, I think it seems to be resolved. Okay, sorry about that, folks.
All right, GoToMeeting, thanks a lot. Yeah, yesterday, Kelly and I were practicing the demo real quick, and she said that there was some sort of problem with the Amazon cloud that was messing up everybody's IT systems. Maybe that was part of it. I thought maybe the Amazon cloud was some sort of global warming kind of environmental disaster, but all right, well, we'll try and keep going here. So anyways, go ahead to the next slide there. Let's get through the spiel and get to the demo. We did this because research shows that data is really important, and using data to manage outcomes really promotes better outcomes. What gets measured gets done. And, you know, in terms of the wraparound world, we've been doing this fidelity data collection stuff here at our research shop and disseminating the tools. But the fact is that collecting fidelity data as an external evaluation function doesn't help individual teams keep on track. And what we also learned is that outcomes and costs may not be monitored at all. So there are some real outstanding wraparound initiatives out there, really nationally lauded wraparound initiatives like Wraparound Milwaukee and Choices that have developed their own excellent IT systems that have been critical to their success. But what we've also heard is that these systems can be obtained by other initiatives, but it sometimes doesn't always translate really easily to new sites or new states. So in consultation with Wrap Milwaukee and Choices and others out there in the field, we were encouraged to develop a comprehensive site and field test it, and also make sure that there's a way that the NWI and social technology can provide the supports to communities to implement and use a system like this. So what we're trying to do is create this resource which is in line with the NWI's mission, that can be customized, that will have training available, help desk, and so forth, and that can really be a valuable resource to initiatives nationally. So that's what we're trying to do. Next slide. So Kelly's now going to give us a little demo. What you're going to see is that Wrap-TMS is intended to be both comprehensive but also user-friendly, that users can log on via a single web-based point of entry, Wrap-TMS.org, and that part of the setup will be to create a unique configuration for each system of care or wraparound initiative that is custom designed to your local initiative. So flexible number and levels of roles and permission, flexible language and nomenclature in the system that reflects your own local initiative, an individualized workflow tracker, providers and service array and billing rates that are specific to your system, the documentation that your system requires, and if necessary, interoperability with other local or state data systems that you need to talk to each other and cross-populate. In addition, what our intent is to create a system that can be customized with features and assessments that are relevant to your system of care. And so again, it's intended to be comprehensive but user-friendly, permission-driven, a user's home screen that shows a summary of current youth or staff, configurable dashboard, users that have access to that task pane, quick movement across the different functions. These are the things that we're trying to ensure are part and parcel of this system. So, next slide. And then finally, making sure that we're creating a system that's secure and compliant and meets all health insurance, Portability and Accountability Act, HIPAA, and FERPA requirements. And something that Kelly can explain if people want to hear more about it is making sure that TMS has the capacity to meet certification as an electronic health record. These are all of our goals for the system. All right, so I've talked enough. Go to the next slide there. Let's go to one more. We've already talked about the kinds of things that are in there. And let's just go one more. Let's get to the demo. One more slide. So what we're going to do now is we're going to have Kelly demonstrate some of the basic functions. And so I'm going to hand it over to my longtime colleague, Kelly Hyde.
Okay. Greetings from beautiful Santa Fe to everyone that's on the webinar today. I'm just going to take a few seconds here and get us to the screen. where we're going to be demoing the team monitoring system this afternoon, and for those of you on the West Coast this morning. The objective of the demo is to really familiarize you with some of the features and functions of the system. Obviously, in the time that we have remaining, we will not be able to cover everything. We will return to a few slides at the end of the demo that will give further instruction on what you can do if you'd like additional information to demo the system for yourself on a 30-day pass, and also acquire additional information on how to actually sign up for more information beyond the demo of the 30 days. So I'm going to start our demo today, and Eric, feel free to jump in if you feel like we need to do any more of the polls, because I know
Sure.
I think we have 2 or 3 left.
Mm-hmm.
I'm going to be showing you today essentially the login and features and functions for what it looks like at what we're calling a supervisory role and a facilitator role within the system. As Eric previously mentioned, the system is very flexible, and there can be numerous levels of login made available, all of which are permissions driven. And I'm going to first start out by signing in as Supervisor Jane Green. And when Jane Green signs in, as you can see within our system, it identifies her as such, and it will also identify her organization that she's with. And there'll be a set of functions at the top right hand that are unique to Jane's user setup. I won't go into those today. What I do want to show you, though, is the information that really pertains to Jane's experience as a supervisor logging into the TMS system. So when I log in, I automatically see that I, as a supervisor, have a clipboard which has quick links that takes me to almost all the major facets of the TMS system. It also lets me add additional information on service providers and organizations that may be relevant to the teams that are configured to work with the youth and families. There's also a dashboard component, which we'll get to in a second, and a reminders section. You'll see that the tablet to the right lists all the youth records that are under Jane's purview as a supervisor. And these are the youth, and if I wanted to, I could access any of them as a supervisor right from a link. However, I also can, as Jane, I can sort on these records by facilitator by simply clicking on a link, and now I just have those youth that are assigned to facilitator Rita Rose. So the clipboard is really intended at a quick glance for the supervisor to be able to quickly get in and maneuver around any of the functions within the system that she's assigned, as well as to almost more importantly, get in and see records that relate to any of those of her facilitators. In this case, we see Rita Rose's, and they're all on a sort function. The dashboard gives a little bit more information, and I'll go ahead and show you that. And again, these are just beta testing views that are configurable across organizations that may be interested in a TMS license or subscription. Again, I'm in as Jane Green, and what I know just from looking at this is that I can see that I have 6 youth that are assigned to my 2 facilitators, and I can just follow them. Sam Smith's youth are shown in red and Rita's in a gold-orange color. This shows you to the left the family satisfaction rating at the present moment on the last assessment taken for Rita's youth as well as for Sam's youth. Now, I was in here earlier populating some test data, so I know that one of the 6 youths has not been fully enrolled. So what we're just seeing are those 5 ratings of satisfaction for the youth under Jane Green's purview that are assigned to her 2 facilitators. And this just shows that if I just hover over it, I see that one of Rita Rose's families have rated their satisfaction as very satisfied, one of Sam Smith as very satisfied, one of Sam Smith as dissatisfied, and so forth. So you can hover over at any time and really see the satisfaction status at the last assessment point for any youth in care. And again, these are not static views, but these should be looked at as tablets that can be rearranged on the screen, and other tablets can be developed and configured for any dashboard view for any role. So these are the three we just happened to pull up to show you today. The second tablet shows you youth by custody status record, and again, those are by those assigned to the two facilitators. If Jane happened to be a supervisor that also facilitated Wrap teams, then hers would also show up interspersed in here in blue. And I can just at a glance see that 2 of the youth are in foster care, 2 are living with a relative, and 1 is in residential treatment. And then the last view, just to give you, again, we're just trying to give you a snapshot of the possibilities of the TMS system. Again, this just shows you of Jane Green's, under her purview, those youth enrolled in Wrap. It just shows you the blue is actually new youth enrolled, and the gold is total youth enrolled, and so it just shows the trajectory of those data points across time. And again, the time, this just sets it up for a year. You know, time and the different data points that can be shown are also customizable on the tablets themselves. The last feature for right now that I'm going to show you before we go into adding a little bit of data to the system is the reminders. So again, the clipboard takes you to immediate features and those youth records so that the supervisor can quickly go into any youth record for any youth. The dashboard shows you a summary of data. And the reminders, intuitively, as you would assume, shows you a list of reminders. And there's filters on the reminders. And this list is customizable to all new case assignments. I'm just going to go on here, assessment reviews. So any assessments that are outstanding that are post due, and you see a lot of these are in 2009. We've been in here for a while adding data. And so any of the sorts that the facilitator, if she wants to or he wants to attend a team meeting, he or she can pull up team meetings. And I know that those in red are past due, and so most of this data in her are past due. If any messages were sent internally, they would be able to be filtered here. If any signatures on any document were required, if Jane's signature was needed for a plan of care, she could filter on those as well. And any youth needing facilitator assignment, etc. So this filtering just allows the supervisor quickly to go in and see what tasks need to be done. And so I'm going to now quickly just move back to the clipboard. And I'm going to show you one other feature that's on the system, which is the menu. You can actually access features through the quick links. We have some of those same features on a drop-down bar. Home always takes you back to the home screen, which would be the clipboard screen of the supervisor. And then there's features, the enrollment, many of the enrollment features are listed out here in the quick links. Some are not. So I'm just going to minimize this for now. I'm just going to show you how we've set it up in this configuration. And again, it's all permissions driven, and depending upon what you would need is how to add a new youth record. And it asks if you want to use a referral form, and that's specific to a group we've been field testing this with. So I'm just going to go ahead and say no. But I'm going to go ahead and I'm going to add myself for the sake of time, and put myself in here. I'll just select this, and I'll change the date, the year to 1995. And so you can see, as at most systems, the red asterisk designates those items that are required to enroll a youth record. And so I was saying to Eric, the facilitator can actually enroll the youth, or anyone could be assigned to do that. We're just trying to get a youth enrolled so that the supervisor now can assign the youth to a facilitator. So I'm just going to go and save those few pieces of required data. And it says ethnicity is required. It will remind you of what's needed. And now I'll go back and save. And then it says, do I want to go and fill in the rest of the details on this youth, or do I want to click no, which would allow me to add more new youth records. So if Jane Smith had 5 youth and families that were newly enrolling on the same day, you could go in theoretically and add them all at the same time. Now I'm going to go back to show you how I would then go. I'm going to go to the home screen and just show you quickly how the system is set up in real time. It shows you Kelly Hyde, and her status is pending, which means she's not been officially enrolled in the WRAP program at present. So I'm going to go ahead and actually assign a facilitator for Kelly Hyde as if I were a supervisor, and I'm going to go to enrollment, and I'm just going to scroll down to assign facilitator. And this is again a permissions-driven function. In this configuration we have it set up so that the supervisor actually assigns a facilitator, and changing facilitators is fairly easy too. So I'm going to actually show you how I would assign a new facilitator. I just put a check in Kelly Hyde. I select Kelly Hyde is in need of a facilitator. Those available are Rita Rose and Sam Smith. I'm going to assign her to Rita Rose and go ahead and assign. But also I know that you can also reassign by just as easily putting a check beside Timothy Jones, because now he is going to be reassigned to Rita Rose, and you can see how quickly and easily you can reassign facilitator that team facilitators across youths. So that's a very helpful feature within organizations where facilitators might change. I'm going to go back now to the home screen, and I'm going to actually log out now, and I'm going to come in as if I am Rita Rose, the facilitator of Kelly Hyde and of one youth that we're going to work with that has a fair amount of data, Oliver Post. I thought I'd pause right here and see, Eric, if there's anything you wanted to add before we move into the facilitator level.
Well, hi Kelly, this is Janet, and I just had a question. So we have someone out there who wants to know if there are any special client system requirements, and whether this is a browser independent system.
It is not. I mean, the browser is independent. It works with any browser. And what was the first question?
What kind of client system requirements there might be?
It's really going to be set up to be compatible with Mac and PC, and of course those are really going to be, you know, the threshold of requirement is that the system's going to move most efficiently and effectively if you're using an operating system that's most up to date. For example, we know that it has it's optimal when you use it on Google Chrome versus using a previous version of a Google browser, just like any other experience you have with an online system. So what we will do, and we have in our user manual, which you'll be getting if you do the 30-day demo, is we tell you what the ideal user environment is, and then you can know for yourself that if your environment is not up to that standard, that you may have a little bit less of an experience in terms of speed. We've also recently been combing through so that issues with pop-up blocking, which is common in a lot of organizations, will not interfere with your ability to use any of the functions.
And then we just actually had a couple of questions about notifications or reminders. So, for example, will a facilitator be notified automatically when they're assigned, and is there kind of reminders, or can you set them up so that when a deadline is approaching, say you need a new plan of care, you know, that
yes.
We're going to show you that, a little bit of that right now, I think.
Okay.
Yeah, the system is set up. The system is interoperable with every user's email system, and so reminders are set up so that once a reminder or once a function is conducted, like the assignment of a facilitator, it can be linked to, and again, it's dependent upon the organization, it can be linked to all the users in the organization. So once a facilitator is assigned, and it's assigned to Rita Rose, then Rita Rose, if the linkage is made, during the setup, she would get an email that said you have a new assignment. As well, the same can happen with any of those reminders, upcoming assessments, etc. I'm going to log out right now and come in as Rita Rose just for the sake of time. I know we probably have a lot of questions, and we are really mindful that you probably want a lot more information than we're going to be able to give you today. Now I'm signed in as Rita Rose. Now remember, Rita Rose is one of the two facilitators under Jane Green. And now, again, I see a similar view, but if you'll notice down here, I don't have that configuration set up to assign organizations and services, etc. So some of the administrative functions are already removed. Again, all of what you see and don't see is permissions driven. So I see a clipboard that shows me just specifically now my youth that, and families that I'm involved with, where I'm the team facilitator. If I go to my dashboard as Rita Rose, I'm going to see a slightly different view than Jane saw. And I'm going to see my new youth enrolled in blue, my total youth enrolled in yellow. And again, you can just see the counts. And these enrolled, again, don't count pending students. So it's only going to count those that are actually enrolled. And again, we're looking at the custody status of those, and this just comes right from the custody status part of the demographics. The living environments of the youth, who are living with relatives, one in foster care, one in residential treatment, and one in other. And then again, quickly, my satisfaction ratings are here. Now this is just an aggregate, again, placeholders. If you think of a card box full of these little tablets, and organizations being able to pick and choose what they said is the standard view, or allowing different roles to customize their views. So these are very interchangeable. We're just showing you 3 right now. And then reminders are fairly similar to what the reminders were. So new case assignments would show up under here, and you can see now my reminders. Under my reminders, there's the new case hide, which I just assigned. And if you set this up from a permissions standpoint, this new case can also be linked to an email that's sent to Rita Rose. So you can actually click into this, and I think I'll just do this from here. You can come into youth records from multiple points in the system. And so now we're in Kelly Hyde's record, and you can see that if I wanted to look at her dashboards, which should be showing right here, and I'll show you a youth who has a lot of data. Once Kelly Hyde's been involved for a while, she too will have a fair amount of data. And there's tabs across the top that really mimic the tabs like in a file, youth file. And so they're youth family team, assessments, services, plans of care, reports, and documents. As well, there is a workflow, and I'm just going to go ahead and access that, that would allow me to know how close or how far I am from actually completing the requirements of the documentation, the required documentation as defined by my organization. This is a customizable feature. So this actually is the workflow of an organization that we've been working with. And you can see that it just says we're 8% completed. And as I add more data, you can actually see this change, and it'll show you the last date of update. At any time, you can also enter through any of these links to actually add data. So you can come in through here. You could actually go in through that the clipboard to enter data, or you can come in through the links at the top, many features. I'm going to go ahead into the youth data. I'm not going to go into this right now, but the family login and family page for each youth and family is accessible at the bottom of a family and youth record. And these have to be set up by that particular facilitator. And they're again permissions driven, so what family, just like any other role, what a family and youth have access to and what they see is dependent upon the permissions they're given. And they are also given the ability to customize their family page as well. So the first thing I'm going to do is I'm going to go in and just change the enrollment status of Kelly Hyde. I'm just going to go in and make sure she's been pending now for 0 days, 0 weeks and 0 days, but there's been a request to know how long youth are pending. And so I'm actually just going to change her to enrolled. And I'm going to enroll her on the same day that she was pending, and I'm going to select her as enrolled, and she can also be discharged or not enrolled through the same status feature. And then I'm going to just save that.
So Kelly, while you're saving that, there's a question that says, when you reassign a facilitator, do you lose the history once the assignment or reassignment has been processed?
We have the capacity to capture history on any collected data, and I can show you a couple places we do that, and so it would just be a matter of adding that feature to collect the history on the facilitator assignment as well. And so I would say yes, that is definitely something that can be added to any organization's feature. So now Kelly is, I'm going to go ahead and close that. So now you can see that she is now enrolled, and there's quite a few demographics, there's funding details, and you can see who actually assigned her, and that was Jane Green on this date. And there's school information, language insurance. Custody is where I'm actually going to just go in and add the custody status, because that's where that custody feature it comes from on that dashboard. And so it's just, again, there's only a few required elements on any screen, so I'm going to pick today. And I'm going to say that Kelly is in a group home.
Right. And it's worth pointing out that right now it's under custody, but it's also got residential status, which is different from custody status.
Right. And so I'm going to actually, so the group home has custody status of her. And so again, these are, you know, all of this nomenclature language is customizable, as well as all of the drop downs are. I'm just going to go ahead and save that. And I'm going to continue on to a couple of the other features. And so the context in progress is where basically you collect your case notes or document any types of contacts with the youth, and then you can actually view all those contacts in progress for youth, and you can actually print out a report at any time that shows all the progress notes on a particular youth. Those are available through the report feature. I'm aware of time, and so I'm actually going to go in really quickly and just take a quick assessment. But I just wanted to show you that the family member information is added here, and it's fairly extensive. The team member information, I think it's important to show you that the system automatically adds the youth as a team member, and it automatically adds the facilitator. And you can, this is where you would actually schedule the first team meeting and add additional team members. And so, and we don't have time really to go into the user, non-user feature, but the system is set up so that team members can be people who are signed up as users of the system, and also natural supports who may not ever use the system but could get an email about a meeting date. And so team members within organizations, there can be lists of team members that are members of other teams. You can set up either to have a drop-down, or it can be a feature that is actually just typed in. And you can choose the team member role. You can add roles on the fly. You can designate this as a formal or informal team member, and then they would show up as a team member. The team meetings, just, you know, when you add a team meeting, I just want to quickly show you that. And the team meeting just will allow you to add a team meeting and select the type of team meeting, and then it asks you which members you want invited, and you can invite all, and you can save it. It will automatically send a reminder to all of those users that are enrolled as users of the system. As well, if you enable the email feature, it can send emails to the non-users of the system. The assessments feature, which is really where the core outcomes are collected, they first come from a set of core assessments that are within the system, and I'll just click on Add to show you a list of those. And those really are fairly extensive, and these are, these are the core assessments that come within the team monitoring system, the community outcomes, crisis plan, etc. You can see all of these. And I'm just going to for the sake of time, just show you a family satisfaction really quickly and show you how quick it is to take an assessment in the system. And it automatically gives you the start date. It knows that this is the first one taken, and so it's just going to ask you how satisfied you are, and I'm going to with the services you've been receiving, and then it also asks for the rating of the progress. And then there's the ability to capture the notes, and you can go ahead and save. It also tells you the next review date. And this assessment is set up to review monthly, but the assessment review schedule is flexible. You can edit it, you can delete it, and this is where you go into review to take a second assessment. Custom assessments are assessments that are either developed. We have a tool builder that's built into this so that each organization can build and publish tools that are unique to their organization. We also have a few built in here. The custom, so if this organization had built any, they would show up here. We have added what we're calling state assessments. Again, this is a demo based on a model that we generated for a client group in Maryland. And so we do have quite a few. If you are just going to purchase or have Wonders, your assessment, taking a Wonders assessment or completing the Wonders data would just require you to add certain WFIs or TOMs, depending upon what your license is, to the custom assessments, and then repeatedly take or add data to those as necessary. We're calling it state assessments.
We do have a question from someone about that we might as well answer. So the question is, we utilize Wonders for our WFIs and TOMs. TMS may not meet our needs, but we would want to continue to enter data on WIFI and TOM and get get comparisons of their data to national benchmarks. The answer is that this system will allow you to continue to do everything you currently do in Wonders. It'll just be a different interface, and it will hopefully be much more efficient and reliable. So, and it will have national comparisons in your reports, just like Wonders does.
Yeah, if you think of this as a nested system, the old Wonders will be embedded in here. It will have the least amount of data features because it's really only surrounding the WFI assessments and the TOM. There will be a select set of demographics, and there will be the same sets of reports and national data available. If you happen to then upgrade to the TMS, you would have the TMS also that would sit. You would be able to see all the features that you're seeing now. You also can buy TMS independent of the Wonders package.
Right, and that answers the last part of their question. People who use TMS will, in fact, be able to look at their WFI and TOM data combined with the other data that they capture in TMS.
Correct. You could have dashboards that are specifically set up, and if you only have a Wonders license, your dashboards will show aggregate TOM and WIFI data if you choose. So I'm going to now go into a youth record that has a lot of data, and we're going to go into Oliver Post. And you're going to see what it looks like now from now we're inside of a record. And this is where the data gets fairly interesting, because now we're in Oliver's record, and you can see Oliver's been in care for what appears to be 7 weeks, or he's been in the initiative for 7 weeks. And again, what we see here is automatically we go to dashboard. We see his assigned case number. We see the youth needs progress, and what we see is need 1, and we can see that need 1 is Oliver needs to be reassured. His past hurts don't have to define him, and that's in blue, and you can see the trajectory, and you can see the rating scale here. And then we go down to family satisfaction, and we can see again the progress and the satisfaction. If you remember when I took the assessment, it was asking you about how satisfied you are with the services and how satisfied you are with progress. So this shows you the key for services and progress.
Right, and there's nothing that suggests that you have to do satisfaction measures every 2 weeks, but it's just the way this demo is set up to show you this one youth's dashboard.
And so here's his school outcomes in blue, current success in school as defined by these success codes mapped against number of disciplinary events or graphed
and again,
events.
all these things could be customized to the youth as well as to your initiative.
Community outcomes, again, number of justice contexts against overall community functioning, just to give you some ideas. And then residential outcomes based on weeks in care. And so, and this is something we've newly been working on. We wrestled with whether to even present it, but just know that the weeks in care are going to match the weeks in care for the youth. But just to show you that there will be actually a trajectory or a mapping of the placements of the youth over time. And you can see that this youth went into residential treatment just recently. And then this is just showing you youth connections at baseline and currently, and these dates are really far off, but again, these are dummy data. And you can see at baseline, it looks at friends, schoolwork, service, family, and community, and then against current. And you can see community went down a little bit, and family did too. And then you can see family connections, baseline and current. And so these are dashboard possibilities, and these data are all generated from those core assessments. As well, dashboards can be built off of custom assessments. I'm just going to quickly, I just want to show you, I'm just going to walk in, I'm going to go into the plan of care. I'm aware, Eric, that it's 5 after, so I'm guessing, and I just want to show you too quickly that when you pull up the workflow for this youth, you can quickly see a difference in terms of his record is 92% completed, and it shows you the different dates of completion. It shows you what's outstanding, and so forth. The team is built. There's 10 members. If I wanted to see, I'm going to just click into this. It'll take me into. It takes me right into the team, and it shows me who's on it. And it shows me about the crisis plan, the completed crisis plan, and that would take me, when I click into completed crisis plan, it takes me right into the assessments that have been completed, and if I click into crisis plan, it's going to show me that youth's crisis plan. So the workflow not only allows a facilitator to better manage their data, but at any time they can quickly get into any piece of information they need. So here's the crisis plan details and the clinical summary. And there's quite a little bit of information, and this is a crisis plan based on a group out of Maryland, and again, these are all customizable. And so now the created plan of care, I'm just going to click on that, and it's going to take me right where I want to go next. And so there's a plan of care in here for a particular youth, and I'm going to just let you view that. The plan of care is set up. I'm going to tell you a little bit about how it works. Once you've entered your youth data, the demographics that I showed you, and all you need is one, I think, assessment and one service, you've pretty much met the designations of what's required for this organization's plan of care. When you go to add a plan of care, it will ask you, do you want to pull all required data elements into the plan of care that you've already added into the system. So there is no place in the system where there's any data redundancy. Once data is entered once, then it's pulled into your plan of care. If we had time, I would show you that, and if you have further interest, we would actually do a full demo of that.
And then we definitely have a few minutes if you would just want to kind of show anything relevant to the plan and how these things populate it.
Okay.
I think it's
so
pretty
I'm
important.
Going to go. So I'll go ahead and add a plan of care here. And so it's going to show you plan of care data that are embedded. So when I said it's not going to, there's no data redundancy, it's already pulled into this plan of care any data that have been previously entered on youth contacts. And these are all editable in the previous part of the system. The vision, mission, and strengths data are all listed here. And then, so the youth and POC details. When you first go to add your first plan of care, the plan of care, since this youth already had one, it would have asked us, do you want to pull the data in? But now it's going to show you and allow you to edit and update a plan of care. It does save all the history of the plan of care. So it will save the first plan of care, and once you make an edit, it will save it as a second plan of care, and once you make an edit, it will save it as a third. And so you have crisis plan and clinical summary in here. And then it says, existing needs and goals were found that weren't previously added. Would you like to add these? And I'm going to say yes, and so this will be an example of a pull-through. And it shows me that within this system there's 3 need statements for Oliver, and I can just click on and add those to the plan of care. And as I do, they populate into his plan of care. As well, I can also...
This kind of emulates the typical flow of the wraparound process, where you may be meeting with the family to kind of learn about needs and strengths, but it wouldn't be necessarily until after some team meetings that you actually select those that will be in the formal plan of care. So you can record your strengths, needs, and culture discovery stuff, and then pull through from that information what goes into the formal plan, right, Kelly?
Correct. Yeah, so you can always pick and choose what you put in. And so it says existing services were found. Again, there's been services that have been enrolled for this youth within the service component. We did this because not all organizations are necessarily going to use a plan of care, but the majority will. So there's been existing click add to plan of care to add the new record. So I'm going to add new. And then this also allows you to add a new service. And so the service, this gives you a chance to see how you might add a new service. You pick the funding stream, and this will be where all the tracking for the service comes from. And these categories in the service tracking piece have all come from the Maryland group, but they, as part of the setup, will be embedded and also can be added on the fly as well. And so once in this group, you always have to, so we're going to be assigning a task. So call vendor weekly for progress update. And then I'm going to make this due date. So the start date of this is going to be the 16th, and the due date for this is going to be the 22nd. And so I'm going to just add this. So what I just did was I quickly added a service because of all the data that previously had been embedded. And then I'm going to actually add a task that's been assigned to a team member relative to this service. And that shows up down here. If we decide we don't want that task, we can easily delete that. I'm going to go ahead and save. And all services and tasks have to be linked to a needs statement. So it automatically brings up those needs statements that have been entered and pulled into your plan of care. And I'm going to link this to these 2 needs statements. And I'm going to continue. I'm going to now just save one more time and continue. Okay, so it's asking me to link it one more time. I didn't have to save that last time. And I'm going to go to next, and it says, I'm just going to existing services found. So I actually need to save this one more time. So we're in a little bit of a glitch here, but I'm going to go ahead and just cancel that for the sake of time. And go on to...
Get you down the rabbit hole there, Kelly.
That's okay. I like to go down the rabbit hole occasionally.
So go ahead and mess around with that and maybe get to the kind of printable plan of care, which is really cool. So all this
right,
stuff
so here we're in there now.
Yeah.
So here we are in the plan of care, and what I want to show you is that, so now we're in a plan of care that's pending, which may require a signature. So if I go into this print feature, I can actually email it. And it asks me what I want to email. An administrative information sheet is basically a plan of care with this group required a plan of care that didn't have identifying information. So I can print one or both, and I'm going to go ahead and print it. And and I'm going to show you some of these features really quickly. But so this is what a printed plan of care would look like, and it's just going to show you. It comes up and it shows you a couple features. You can print it right from the screen. I'm going to maximize it, and you can just see now that the plan of care has 12 pages. It's pretty extensive. The administrative summary would have just those pieces that are most relevant without identifying information, so your organization might want to also have an administrative summary. And so this is just that plan of care. I'm going to actually minimize this screen and go back. So you can print it, you can edit it, but I'm going to go in here to the email because this previous one was already set up for email. And so once a plan of care has been created and is pending, you do have the choice to send it out for signature through this system. And I've set this up ahead of time just for the sake of time. But when you choose to email a document out in this system, you can do it right here from this. And so it will say, first it asks who you'd like to send it to. And you can see it's already been sent out to the facilitator for the signature. If accidentally it gets sent to the wrong person or the facilitator is ill and the case gets transferred, you could recall that. And I've already sent it out, and I'm just going to show you what that looks like. Really quickly, I'm going to go into my email accounts and show you. So you can also reset for all, and that resets it back to a status as if none had been sent. And so there's a lot of things you can do, and once that they are all signed and sent back, it will say that they've been received. It also has a due date function there. And so maybe this would be a good time for, I don't know, a poll question, and then I can go into the last feature, which would be to show where this gets emailed to. I also want to go in and show how to create a report out of a dashboard and assign it into the documents file.
Maybe we should pause and do some of these questions. There's a ton of them. One thing that's on multiple people's minds is whether or not you can upload other kinds of documentation, such as can you fax or email other documents, hard file? Can you scan into them into the electronic file?
Absolutely. So I'm going to just show you how to do that right now. So there's a document repository for all of the youth files, and that's under documents. And you can, I'm going to just choose this off of my desktop, and I am in the desktop, and so I'm going to choose to, this is his last POC, so I'm going to just choose that, and I'm going to open it. And again, you can label those so you know what, these labels are customizable, but anything can be uploaded into here, into the document repository. It may take a little bit of time. It's up now. And so you can create different categories. I'm just going to call this assigned POC for lack of a better term. And so that's what it is. And so these are existing documents. And I'm going to choose file.
So while you're doing that, a couple other questions. One is, a couple people have been asking about customization. So for example, can it be customized to a particular region? Another attendee asked whether or not you can assign folks to specific programs, I guess, within an initiative. And the answer is that, you know, those are examples of the kinds of customizations that this allows for any local program that wants to use the system, or even a statewide initiative. You can assign folks to, the permission levels allow you to have multiple programs or counties or providers, you know, wraparound agencies. Another relevant question in that kind of ballpark was the question about whether or not custom assessments could create graphable reports, and I think the answer is absolutely yes. You might talk a little bit about the drag and drop reporting that you're going to be building in.
Yeah. We will be building in, I don't know if any of you are familiar with drag and drop reporting. If any of you are evaluators on this call, the latest version of SPSS is a good example of that, where all eligible numeric variable data, anything that is measured, even categorical data, which is a little bit harder to work with, would be available. Any variable is available to be pulled in, and a graph can be created as a result. Assessment score data where you're going to be actually creating a little bit of coding. So if you need to add up subscale scores and get a final score and you want to graph the final score every 6 months, there would be a little bit additional programming required. But if people are buying this and they have people on staff that have the knowledge to build an assessment, I'm certain that they would be able to comprehend and understand how to use the drag and drop reporting to be able to publish a report of that nature.
So this is Eric. I actually have to step off of the webinar because I have to go get on a plane. The webinar can continue till 12:30, and I'll and let folks know who are asking on the chat line about availability and costs that Kelly will cover that. And sorry to have to step off, but it's been a pleasure to do this for folks, and I look forward to hearing more about what people's questions are, and thanks for joining us today. Janet, I'll hand it back to you to make sure that other questions get answered.
Great. Bye, Eric. And we do have
Bye.
a lot of questions, so we're going to try to get to the ones that people are most concerned about. But as Eric mentioned, it seems that Kelly will be covering some of this, so hopefully we'll have at least some few minutes at the end. Thanks.
Yes. So I'm going to go and just show two last features, and one is, now you're all seeing my email. So one is that once you use the email feature, remember Jane Green is the supervisor, and I actually went in there and created a plan of care. And so once you sign out something that needs a signature, it's going to come into an email looking like this. And so just to show you that you can auto sign, and codes are going to be sent also by email. Once you put that code in, you submit it, and the person will be able to sign it on their computer and send it back. You can choose to use the auto email feature or not. I just wanted to let you know that that is available with the plan of care and the crisis plan. Now, those are the only two signable documents that this organization wanted to attach the email feature to, but it can be attached to others as well. So you can upload files, and this is just an example of how you can upload files into the repository. Once they're uploaded, you can view them from here, and they can be those created internal to the system or those that are obviously you can pull off of your system. Let's say there's a report that comes in from a physician, and this is saying, do I want to view it? And I'm going to say keep it. It pulls it into a viewable PDF file because I have Chrome, and then it just shows you this shows you a little bit about the Oliver's timeline, which is a feature that's a feature of the system. And so this just shows you that document, and it shows you that he was born, he came to live with the grandmother and removed, and this is just a brief synopsis of that, but the timeline can go on and on, obviously. And so this is just really to show you that you can save any document that's in a Word PDF. I think pretty much, I'm not sure if Excel or any PowerPoints can be saved in here, but I know PDF and Word files certainly can be. You can also delete them over time if they're time sensitive. I'm just going to really quickly go in and show you one last feature, and then I want to go back to the slides and then open it up to questions. I'm going to go into the menu. Eventually, the home screen will include, we're in the process of changing around a little bit of the functionality. It will include an Reports tab and an Output tab. Right now, and we got a lot of that feedback from field testing that has occurred in the last 8 months and at the Georgetown Institutes in July. And so right now, to create an export or report, you come to assessments, and I'm just going to for the sake of time, I'm going to show you how this particular facilitator would create a report on an individual youth, and I'm going to use Oliver Post as the example. And so most people are going to have more than 4 youth on their caseload, so I'm just going to actually, it says you need the last name first. I'm just going to put a P in there, hit search. It's going to pull up all my youth that have data available for graphing and reporting. And so I'm just going to put a check in the youth whose data most I want to generate. And I'm actually going to pick the assessment from which those data will be derived. And I'm going to pick family satisfaction because I want to see what happened recently. If you remember from the dashboard, the data looked like the family and youth were relatively satisfied and then not so much. And so I want all the data, and I want it in a graph, and you can also get it in a spreadsheet, and I want it to include numeric and text values. And so this is just a filtering feature that also can be slightly customized for by roles and also by organization. And so now I'm going to preview the output of that data. And it's going to say, do I want to print that output? I want to email that report. And I'm actually going to email that report. Or actually, first I'm going to print it. And I'm going to show you what that looks like. And it's basically going to give me a report that looks exactly like the dashboard. So if the next meeting is going to be around the concerns around what's recently happened with the satisfaction and the team meeting, this is the report. You can easily export that to a PDF or Word and save it on your individual computer, anyone who has access to this record. As well, when I preview that output again, oops, I don't think I have to go back and select again these. Oh, it's there. So when I preview that output again, I can also send it to the youth record. So and email that out to all the team members. So remember, all the team members will be enrolled. Not necessarily all will be users, but hopefully everyone will have an email address. So if there's something of concern that you want to send out to the team, this is an excellent way to do it. I'm going to continue, and you'll see that I select a label, Youth Reports, continue, and it's going to take me into that document repository we were previously in. It says, well, it's going to save it there. I'm going to go back to Menu. I'm going to go back to Home. I'm going to go into Oliver Post. And when I do, I'm going to go into Documents, and there's Oliver's Family Satisfaction that I generated today, and I'm actually going to try to view it from here, although it's saying, are you sure you really want to view this file? But I do. And then I'm going to, that's going to be the end of our demonstration once I open this. So let's see. Visual downloads of Family Satisfaction. Keep anyway. So here it is in all its glory. But basically this is just to show you that any data that can be configured into a dashboard automatically becomes a report. And so just know that just by virtue of configuring the dashboard, you're actually configuring reports, and then the keys down here. And so on that note, I'm actually going to go back to the slides, and I think we do have one or two poll questions left. I know we have quite a few questions left about the what is next. And so I thought I'd just first go over the last few slides we have, and then maybe we could do the remaining poll questions on interests and what particular aspects of the system would be of interest. So TMS is being offered as software as a service. If any of you have software subscriptions online, that's a software as a service. Software as a service differs from a packaged software that you buy on a shelf at like Staples, for example, in that it does not sit on it sits on a server elsewhere, not on your own server or system, but it's accessible in this case online, and it's offered on a subscription basis. How this will be offered is still under development, but as Eric stated, they will be an implementation package that will be offered, which will include setup, initial training, and help desk support. And then ongoing, the subscription will offer the help desk support. Available for additional purchase, obviously, is customizations across the system to the extent that you need that and can't do that within your own organization, or even just training for how to do that within your own organization. We can offer separate data solutions as well, such as integration and interoperability with other systems in your state. And like Eric said, we are moving to be electronic health record certified. So again, here is a little bit about the cost. So there is going to be an initial cost for training, implementation, and setup. Then there's a software licensing cost based on number of user license, and it can be billed monthly or annually depending upon your need. And then customizations are separate. We've really set this up so that you can take this and fish for a lifetime. You can take this and create your own reports. You can take this and set up your own dashboards. You can take this and set up your own assessments. And but it's also set up so that we can assist you with all of those things as well. And so I'm wondering if so then how do you further inquire about the TMS system? Again, there's 3 things available here. There's the current Wonders system, which will be moving on to this. If you're a current subscriber already of Wonders, you'll automatically be enrolled as a subscriber on this system. And again, it's like a nested model. You just have those features available to you to assess fidelity relative to the WFI and the TOM. Your configuration and setup will be exactly like it is on Wonders, but I can guarantee you it'll be much more efficient and effective. You would also then be eligible, if you wanted to upgrade to also have the TMS in addition to the Wonders package, or you can just have TMS in separate and aside from the Fidelity package. There is going to be the Wi-Fi brief embedded within the TMS, and so there will be some fidelity assessment in the TMS system itself. So if you are interested, you will be contacting the UW Wraparound Evaluation and Research team at this email address, and they'll be happy to schedule a discussion of first steps with you. Those will likely include, if you're interested, a 30-day pass to our TMS demo site to test the system and its functionality. We've had probably about 15 beta test organizations on there. Some have built instruments. We've had various level of use in there. So it'll be a 30-day trial that would set up from the time that you inquire and say that's of interest to you. And then it would expire after those 30 days. And then we'd further discussion if you're interested. So I think that's about it, and I think we're just about out of time. I know there's quite a few questions, and I'd like us to perhaps pause now and do the remaining 2 polls. I don't have access to those polls. Hello?
Yeah, look, we have a poll going right now.
Okay, you do. Okay.
So I'm wondering, in the meantime, I've just been scanning the entire list of questions, and there are a lot. But I'm wondering, people are wondering about. Okay, so the 30-day trial is free. Is that correct?
Correct.
Okay, and then after that you can sign up. So that's, several people have that question. And then there are just a lot of people that want to just have a ballpark idea for what the price would be for the basic ongoing TMS enrollment, just because they don't know if they should even look any further if it's totally outside of their budget.
Yeah, I mean, we are pricing ourselves. I can't give you an actual figure right now, but I can tell you that we've looked at pricing structures for all social software systems that we'd be in competition with, and we plan to stay at least to those costs or much lower. I mean, both Eric and I believe we want to get this in the hands of the users who need these systems. At the same time, we're trying to run a system that's efficient and effective, and part of that does require monthly upkeep. And so I know that sounds fairly amorphous, but I can tell you that both Eric and I plan to keep these prices reasonable and also commensurate with the size of your organization. And so if you're a small organization and wondering if you can afford it, the answer is yes, because we will set it up so that the user license is not, you're not going to be paying for one user license. The user license would be grouped in either sets of 5 or 10. And so, if you're a small organization, you're not going to have to be, just paying for all 5 of those users. You would just pay one flat rate for those 5. And again, the systems that we have viewed, we know what those rates are, and we're going to be much, our prices are going to be much better than those. I just can't give you prices today, as that's a meeting that we'll be having with Adam and his staff, and those things will be decided shortly. We do have some estimations, but I can't release them.
Okay, and so presumably people can get in touch at the email the email addresses that were given before, and kind of get on I suppose something like a wait list to receive cost information when that becomes available.
Yeah, and we guarantee that that information will be made available. I mean, what we are aiming for is that we'd be enrolling our first users. The users that are coming on to Wonders, onto TMS, will be coming on by the end of November, and that was our first project, was to get everybody off of that system and onto this system. And then I've been in this business long enough to know that December is never a good time to initiate and roll out a new software system, and so we'd be enrolling, hopefully people would be using their 30 days sometime between now and January. If you do need a longer period of time, we can extend that. We're not, things aren't cut in stone, but we'd like to start to offer it to people in January, so we'll have the pricing out hopefully no later than December 1st.
There's another question here. I mean, here we have the answers to the poll. Kelly, I don't know if you have any comments on that, or if you want to switch to that final poll.
So I see that we have interest in data-driven supervision. And can we save these polls?
Yes, they're all saved, and they're available with, if people who are on the webinar are interested, they're also posted with the webinar slides and all that.
Okay. So I see that the data-driven supervision produced high level, and I can't read the end of that, the 71%.
Reports on outcomes.
Reports on outcomes, which you can see that the system does very easily. Flexibility and customization. That's where we started with this system, because I've worked with many systems, as has Eric, and our desire was to set it up so that flexibility and customization would be relatively easy and wouldn't cost your entire organization's budget. In fact, it would be something that people in your organization could do. And then the health record and interoperability, a little bit less of an interest, but still somewhat of an interest, and the data-driven supervision, as I previously mentioned. Okay.
Okay, so let's put up that final poll, and while that's going, perhaps just a couple more questions. There were several people actually asked whether the emails that are sent out in terms of reminders, and I guess the other ones that go out to team members, are those encrypted, secure?
Yes, all of this, I mean, to be able to embed an email system in this and meet HIPAA requirements, we sat down with all the HIPAA requirements before we even designed the system, so the email system is encrypted. And you kind of saw that how you had to get into the document signing, etc. And all the documents that are sent out by email would have that same level of encryption, as well as just normal emails in general.
Mm-hmm.
6, okay.
All right, I'm thinking we can see the results of that poll, and because we are down to about our last 30 seconds here.
Okay. And so it looks like I'm not able to pull out those first two.
Okay, so it says your level of interest. Okay. Most common response is high because people do not have a wraparound specific IT system.
Mm-hmm. Okay. All right. Well, that's kind of what our desired end result was, is to kind of, you're our target audience. This system really was built for viewers like you, and this feedback is extremely helpful. I do know that if you have any interest whatsoever to sign up and get a demo, get onto the demo system. It doesn't cost anything, and we always welcome the feedback. So on that note,
just to clarify one thing before we close, because there are a bunch of questions about this. So if people want to access the demo, they just use the email to contact the work team. Is that correct?
That's correct.
Okay.
And it will take us about, you'll probably, within 1 to 2 weeks, you will receive back all the information you need. You will probably receive a supervisor and a few facilitator logins, and we'd ask you to use those. You can kind of understand conceptually that everything builds up from there, and so the views, everything's permissions driven. So we kind of give people, and we can give, if you are interested in learning how to build the customizable tools and more of an administrative view, we can give you that level of access as well.
Okay, and so basically, unfortunately, there is a whole long list of questions here, and the way to get those answered is to email Wrap-Eval. Thanks to Kelly for her demo and for answering all of our questions about TMS. Thanks to Eric, who is not with us anymore, and thanks to everyone who's been on the line today. We hope that you had an interesting and useful experience with the webinar. Look for future webinars, information on that on the website and in your email coming soon. Okay, goodbye everyone.